Okay, so let's talk about lysosomal storage disorders, and there are these many. And basically, it's how you identify which one is which. Now, the first we remember together Tay-Sachs and Sandoff. Tay-Sachs and Sandoff is the enzyme deficiency is the same, except Sandoff is hexoaminidase A and B. Tay-Sachs is just A. Okay, ASAC में ganglioside is accumulating. Sandoff may, because it is A and B, ganglioside and lobocyte is accumulating. Now remember, almost everything will have mental retardation. What you can see in orange is mental retardation, which is in everything except Fabry's and Sandoff. Okay, they don't have mental retardation. If you can remember, Fabry and Sandoff don't have mental retardation, good. Otherwise, it's okay. So remember, Tay-Sachs also has mental retardation. What you need to pick up is if the question has blindness written. Okay, there's nothing which is causing blindness. Okay, they're saying that there's blindness, then it is Tay-Sachs. And there's also muscular weakness. So blindness agar hoga, it is Tay-Sachs. Also see, it is hexoaminidase A, and what is accumulating? Ganglioside is accumulating. So Tay-Sachs is easily identifiable. Sandoff is A and B, ganglioside and lobocyte is accumulating. Features are the same except that they also have hepatosplenomegaly and they have skeletal dysplasia. So whenever you have skeletal dysplasia is present, there two things need to come to mind. Dysplasia is there in Sandoff. Okay, dysplasia is there in Sandoff, but skeletal deformation is there in Faber. So just remember ki see the question also. Hepatosplenomegaly agar hoga, then you have to think about only three diseases. One is Sandoff. One, see, hepatosplenomegaly is in blue. Hepatosplenomegaly is Sandoff. One more is Gaucher, and one more is Niemann-Pick. In all of them, three things may you have hepatosplenomegaly. Next, you have is Fabry's disease. So remember, A gal having one girl is Fab, but having B gal, which is having two girls, is Crab. So that's how you can remember that A gal is Fabry's, B gal is Crab. Okay. In Fabry's, what is accumulating is globotriaosylceramide, that is GTC. Okay, and what do you get in Fabry's? Now Fabry is like a fabric. Remember, the fabric may you can this is a fabric, so there are these red dots. So these are angiokeratomas, which are there, like a skin rash which is going to be there, skin rash, angiokeratomas. And what you also get is hypohidrosis. Also, they have kidney failure. That means what? You get a foamy urine. They'll say that in their clinical picture there's a foamy urine. So whenever they say that, you should remember is this Fabry's disease. Now all of them are going to be autosomal recessive except Fabry's, which is autosomal, which is X-linked recessive. So only Fabry, you can remember that by Fabrics. So Frix is X is for X-linked recessive. Next you have is metachromatic leukodystrophy. Usme what is going to what is the enzyme deficiency? It is aryl sulfatase A. Accumulating is 3-sulfur-galactosylceramide. And what you get in this is demyelination. So whenever they say okay, this person mein demyelination was formed, it is metachromatic leukodystrophy. Next is Krabs disease. Krabs disease, as we said, is because of beta galactosidase, and what is going to accumulate is because beta galactosidase is not there, there is galactosylceramide, and what you get in the question is that myelin will be absent. So then they say that CNS mein myelin was not formed. Then think about, oh shit, myelin is not there. Crap, no myelin. Crap, no myelin. So that will give you a short answer that this is Krabs disease. Gaucher's disease is because of Gauche is glue. So you can remember beta glucosidase is Gaucher's, and what is accumulating? Glucosidase nahi hai to glucosylceramide is accumulating. So this is similar. Crab mein beta galactosidase is not there, galactosylceramide is accumulating. Glucosidase is not there, glucosylceramide is accumulating. Now remember Gauche, ouch, Gauche, ouch. You can remember the ouch is for the bones because they have erosion of long bones. Next is that they have something called as crumpled cell. They'll show you an image of a cell which has these like crumpling. That is going to be in Gaucher's disease. So two points are there. The question stem says they have bone pain, and they also have this crumpled cell, like a crumpled tissue paper cell. That is going to be Gaucher's disease. Apart from that, they also have HSM, that is hepatosplenomegaly. They also have mental retardation. If you can pick that up, great. If you can't pick that up, it's okay. But remember, hepatosplenomegaly is there in only three things. One is Gaucher, as we spoke. Gaucher में होता है hepatosplenomegaly. One is Niemann-Pick, and one is your Sandoff. So you have Gaucher, Niemann-Pick, and Sandoff, which has hepatosplenomegaly. If you remember this, good. If you can't, it's alright. Next is Niemann-Pick disease. Now, Niemann-Pick disease is because of sphingomyelinase. And what is accumulating? Sphingomyelin is accumulating. And what you get, it is fatal condition. Okay, so they'll say fatal, dead early in lifestyle. They also have mental retardation. They have hepatosplenomegaly. One thing that you should remember is that Tay-Sachs and Niemann-Pick both have cherry red spot. That will also be a clincher. Cherry red spot hai. So only two things should come to mind. One is Tay-Sachs, one is Niemann-Pick. Sandoff also sometimes will cause Gauchers will also form this thing. Cherry red spot, not Sandoff. Gauchers can also form as cherry red spot. So it can be Tay-Sachs, Niemann-Pick, and Gaucher. But we know how to recognize a Gaucher person. Okay, we know that they'll have bone pain, they'll have a crumpled cell appearance, they'll have hepatosplenomegaly and everything. But Tay-Sachs does not have hepatosplenomegaly. Tay-Sachs mein that you should remember that Tay-Sachs does not have. How you remember that? Tay-Sachs and Niemann-Pick. Niemann-Pick stands for big. You can remember big, pick. So big मतलब hepatosplenomegaly रहेगा. So that way you can find out that okay, अगर hepatosplenomegaly नहीं है, then it is definitely Tay-Sachs. अगर है, then you can be confused between Gaucher and Niemann-Pick. And Gaucher we know how to identify. They'll have bone pain. Niemann-Pick में there will not be anything like that. In fact, they'll die early. Next is Farber's disease. Farber's because of ceramidase, and what is accumulating is ceramide. Now ceramidase, ceramide. Now remember that ceramide we use in all beauty products and everything. So that is going to cause dermatitis because it's not going to, that skin dry ho jayegi, breakdown ho jayegi, so there will be dermatitis. There will also be hoarseness. If somewhere there is hoarseness of voice or there is hoarseness written, think about Farber. Farber sounds only like someone saying something very hoarsely. So Farber is hoarse. And you can also remember skeletal deformation, skeletal dysplasia if there's there, that is Sandoff. Okay, S for skeletal dysplasia, SD, Sandoff's disease. S for skeletal dysplasia. Deformation रहेगा, then think about Farber. And this is also fatal early in life. So what all is fatal? You have Niemann-Pick, which is fatal, Farber's, which is fatal. Then there's also you're going to have absent myelin bolega, so that is Krabs disease. Okay, so two things you should remember about Niemann-Pick and Farber. There's not much to remember. Not many people will ask. Farber's because ceramidase, accumulating is ceramide. Niemann-Pick is sphingomyelinase, accumulating is sphingomyelin. Gaucher is beta glucosidase, accumulating is glucoceramide. Galactosidase crab में, so that will be galactoceramide. Metachromatic leukodystrophy में aryl sulfatase is absent, accumulating is sulfo-galactosyl ceramide. So remember galactosyl ceramide is crab, but if it is sulfo-galactosyl ceramide, then it is metachromatic dystrophy. So similar. Fabry's में what is you have GTC, which is globo-triosyl ceramide. GTC is Fabry's, and that is the only one which is X-linked. Sandoff में and Tay-Sachs is similar. You have hexoamidase A missing. Sandoff has B also. Ganglioside is accumulating in Tay-Sachs, and Sandoff is ganglioside plus glucoside. That is all. What is the clincher? Tay-Sachs will have cherry red spot. They'll have blindness. They will not have organomegaly. Sandoff will be the same as Tay-Sachs along with hepatosplenomegaly and skeletal dysplasia. Fabry's, you should remember Fabry's has that angiokeratomas, which is a rash. It is going to be X-linked, and they're going to have hypohidrosis, and they'll have kidney failure, which will precipitate as foamy urine. So whenever there's foamy urine and you have a feeling that this is a lysosomal storage disorder, it has to be your Fabry's disease. Okay, then you have metachromatic dystrophy. इसमें कुछ है नहीं. Metachromatic dystrophy, you should remember that demyelination starts taking place, and they'll also have some psychological disturbances. Krabs disease, absent myelin. Gaucher's disease will have bone erosions, long bone erosions, crumpled tissue paper appearance, hepatosplenomegaly, maybe cherry red spot. Niemann-Pick has a cherry red spot. That's the only thing you should remember. Sphingomyelin should remember. In large HSM भी होगा उसमें hepatosplenomegaly and mental retardation. Most of them have mental retardation except Fabry's disease, which does not happen. Or even this one Sandoff has, because it's the same as Tay-Sachs. Only Fabry's does not have much of mental retardation, but remember everything has some mental retardation. Forget only, you will not be able to pick up something based of mental retardation. It's a common feature. What you should remember is the one which is very specific to that disease. Niemann-Pick में we spoke के उसमें enlarged liver spleen, cherry red spot, and nothing, no other feature. Farber's में hoarseness, dermatitis because of ceramide. That's all.